Bismillahirrahmanirrahim. Dear student, welcome to the course of Pharmacology and Therapeutic. I am Fawad Ali, Assistant Professor, Department of Pharmacy, Quart University of Science and Technology. Today we will discuss about an antibiotic group which is macrolide. In today's lecture, we will discuss the following contents one by one, like what is erythromycin, its chemistry, antibacterial spectrum, mechanism of action, its mechanism of resistance, pharmacokinetic properties of erythromycin, therapeutic uses of erythromycin, adverse effect, and its interaction. Okay. Our lecture outcome will be after watching and listening this lecture, student will know about the erythromycin mode of action, clinical uses, which is based upon its spectrum, bacterial spectrum, and unwanted effects. So, following are the drugs included in macrolides like erythromycin, clarithromycin, and azithromycin. Chemistry of the macrolide. Macrolide have a large macrocyclic electron ring, which is also known as macrolide ring, to which a deoxy sugars are attached. Okay. Journal structure. They all have three characteristics part in their molecule, like a macrocyclic electron ring, a ketone group, and amino deoxy sugar. This is the basic nucleus of macrolide, which is this is the macrolide ring to which a deoxy sugars are attached. Okay, in macrolide basic nucleus, there are two important substituents, which is R1 and R2. For example, in case of the clarithromycin, the both at R1 and R2 position methyl group are attached. But in erythromycin, R1 at R1 methyl group are present and R2 hydrogen atom is present. So the prototype drug of macrolide is erythromycin. Erythromycin isolated from the streptomycin erythraeus in 1952. The general properties of the erythromycin are like they are pure base, poorly water soluble, but soluble in organic solvent. Stable at 4 degrees centigrade, it has stability at 4 degrees centigrade. Its lose activity at 20 degrees centigrade and at acidic pH. The activity of erythromycin is enhanced specifically in the alkaline pH, at basic pH, dispensed as an ester in salt form. Antibacterial spectrum. So the spectrum of the macrolide erythromycin. Erythromycin is the basically bacteriostatic, but may be bactericidal in higher concentration against a very sensitive organism. It is effective against the gram negative. It is effective against the gram positive cocci and bacilli. Very effective against the gram positive cocci and bacilli, specifically aerobic, like for example Streptococcus pyrogens, Streptococcus viridans, pneumococci, staphylococci, clostridium, parapharynges, corynebacterium, listeria monocytogenes. These are the gram-positive cocci and bacilli. They have high lift, so macrolide, like for example erythromycin, are highly effective against these gram-positive cocci and bacilli. They have activity, but less activity against the gram-negative organism, including H. influenza or Neisseria meningitis. Erythromycin also show activity against Neisseria gonorrhea, Bordula pertussis, Helicobacter pylori. Mechanism of action. Like bactericidal, it is bactericidal, but bactericidal, which we discussed earlier, depending upon the dose, but bacteriostatic, but bactericidal for some sensitive microorganisms. It enters the bacterial cell by the passive diffusion, bind with the receptor. Okay, before going to the mode of action of the macrolide, we will discuss the protein synthesis, the protein synthesis of the bacteria, how proteins are synthesized in the bacteria. Like DNA is shown as a double stranded. This is a DNA double stranded strand in bacteria. So like other DNA of all the living organism, they contain the unique genetic codes for all of the protein required for the bacterial survival, reproduction, growth, and metabolism. They also code for three kind of the RNA. They also code for three kind of RNA, like required for the protein synthesis, known as the ribosomal RNA, a transfer RNA, and a messenger RNA. In protein synthesis, double-stranded DNA is unwinded, and separate in a region which code for a specific protein that is made. It is unwind and convert into the single-stranded. Once one strand of DNA serve as a template for this process. Like one strand of the DNA, strand of DNA serve as a template for this work, known as the transcription. This is a transcription. Like for example, one strand of the DNA serve as a template for this, and the process is known as a transcription. Transcription result in the formation of the messenger RNA. One of the strand of messenger RNA, once the strand of the messenger RNA is complete, it will detach from the DNA template and in turn attach into the ribosomes. This is if the template, well, once the strand of the messenger RNA is complete, they will detach from the DNA template and in turn attach to the ribosome for the protein synthesis. So ribosome have two subunit, 50S and 30S. 50S is the largest subunit and 30S is the smaller subunit. Okay, then after this, the synthesis of the polypeptide chain begin. This step involve the align of the transfer RNA molecule. Each transfer RNA molecule carry a unique amino acid determined by the sequence of the transfer RNA, which when aligned along the messenger RNA, which when aligned along when the messenger RNA ribosome joined together, ribosome 50 and 30 is joined together to form the polypeptide chain. This step is known as a translation. This step is known as translation. Ribosome continuously adding amino acid to the polypeptide chain. This is a polypeptide chain until it reaches the point along the messenger RNA, signaling signal it to stop. At this point, ribosome releases the finished molecule. This is a normally, like for example, simple, like DNA is converted into RNA. This is known as a transcription, and like for example, which is also known as messenger RNA. Messenger RNA is converted to made a polypeptide chain or ultimately the finished protein. This is a general basic mechanism how protein are synthesized in the bacterial cell. Okay, going to back toward the mechanism of action, like this and so macrolide, for example erythromycin bind with the receptor 50S ribosomal unit of the bacteria. They inhibit the translocation step, inhibit the elongation of peptide chain. may also interfering with the formation of initiation complex, like messenger RNA plus formylmethionine plus transfer RNA. This is an initiation complex to which the different amino acid are added by the transfer RNA and converted into the polypeptide chain, resulting in the formation of polypeptide chain. So its activity is enhanced in the alkaline pH. So this is the ribosome, like 50S and 30S ribosome. This is messenger RNA. Okay, this is macrolide, the drug molecule, the ligand. Like for example, this is erythromycin macrolide. So they bind with the 50S ribosomal subunit. Okay. As a result, they block the ability of the ribosome. They block the ability of the ribosome to synthesize the polypeptide chain. They block the ability of the ribosome to synthesize the polypeptide chain. They inhibit the translocation step. Okay, this is the like for example, this is an initiation complex. Macrolide, no peptide bond form. Macrolide present, no peptide bond form in the presence of the macrolide. Like this is a macrolide. They interrupt the initiation complex. So erythromycin and clindamycin bind to the 50S subunit. This is another diagram taken from the Lippin cord. This is a 50S ribosomal unit. This is 30S ribosome. Erythromycin bind to the 50S. So it's a 50S ribosomal subunit and inhibit the translocation step, resulting as a result the ability of the ribosome to synthesize the polypeptide chain is also inhibited by the erythromycin, and hence the protein synthesis are altered. So other antimicrobials binding to the 50S ribosomal subunit of the sensitive bacteria and inhibiting the protein synthesis are like macrolide, chloramphenicol, lincomycin, and clindamycin, linezolid. These are the drugs included. They have the potential to bind with the 50S ribosomal unit and inhibit the protein synthesis. Okay, resistance. Resistance of erythromycin. Erythromycin show a natural resistance like against some species, for example, some Staphylococcus, pneumococcal, and streptococcal species. But they also show acquired air resistance, like they reduce the permeability of the cell membrane. Efflux of the drug by an active pump mechanism increase the efficiency of efflux pump. Efflux remove the toxin, the substances of the bacteria from the body, outside of the body. Efflux pump, the mechanism of the efflux pump is to remove the substances toxic to the bacteria. So the efficiency of the activity of this pump, the efflux pump, is increased. So the efflux pumps remove the antibiotic uh, also from the body. Methylase enzyme lead to the ribosomal modification and inhibit the binding of the drug. Methylase enzyme lead to the ribosomal because it's the modification of the ribosomal lead to the ribosomal modification. Methylase in the lead to modification in the binding site of the ribosome and inhibit the binding of the drug. Some enterobacteriaceous species like E. coli, Klebsiella pneumonia, they produce esterases, resulting in the hydrolysis of the erythromycin. Ribosome protection, alteration of the 50S ribosomal protein by chromosomal mutation. There is some alteration at 50S ribosomal subunit by chromosomal mutation, resulting in the ribosomal protection. Like macrolide, for example, erythromycin cannot bind if this alteration, because erythromycin bind with the 50S ribosomal unit. If there is alteration in the 50S ribosomal unit, so erythromycin can't bind at the at the 50S ribosomal subunit. Okay, they show cross resistance. Cross resistance complete in the whole group means if a drug is resistant toward, if the species, if a one species is resistant, if a patient is resistant toward, for example, if a patient is resistant toward the erythromycin, he will be resistant toward the erythromycin and also azithromycin. So it show cross resistance complete in the whole group. Pharmacokinetic properties of erythromycin. Pharmacokinetic properties include absorption, distribution, metabolism, and excretion of the drug. So absorption, they are present in erythromycin base form, erythromycin ester form. In ester, they are present in estolate form. In estolate basically lipid soluble, acid stable product. It undergoes hydrolysis in the blood or tissues after absorption. Second ester is erythromycin ester is ethyl succinate. This is a mixed double ester product of erythromycin. Better oral absorption, and the oral suspension for children are mostly from the ethyl succinate and without bitter taste. So propionate, lipid soluble ester of propionic acid. It have the better oral absorption as compared to estolate and ethyl succinate. Okay. Erythromycin salts. Erythromycin also present in salt forms like erythromycin stearate, erythromycin salt, lipid soluble salt of the stearic acid. It has a better oral absorption. Acid sensitive enteric coated form is acid stable. In small gut based exchange occur and free erythromycin releases. Second salt of the erythromycin is erythromycin lactobionic, water soluble salt of the lactobionic acid for parental dosage form. Last erythromycin salt is erythromycin glucoseptate. It is also a water soluble salt of the glucoheptonic acid, and it's also used for the parental uh, dosage form. So in like erythromycin lactobionate and glucoseptate, they both have the water solubility and used for the parental dosage form, while the erythromycin stearate is a lipid soluble salt of the stearic acid. Distribution, diffuse readily into the intracellular fluid. Activity can be achieved at all sites except the brain and CSF. It cannot cross the blood-brain barrier. Poor penetration into the synovial fluid. Plasma protein binding is 70%. Concentrated in the liver. Elimination half-life is 1.5 hours. It crosses placenta. Highly concentrated in the prostatic liver and bile. Metabolism. It is mostly metabolized by the cytochrome P450 microsomal enzyme, which is specifically CYP3A4. Elimination, mainly in the bile as an active metabolite. In bile, concentration may be 50 times that of the plasma. Undergoes enterohepatic circulation and lost in feces. Inactive metabolite excreted in urine only 2 to 5%, very small amount. That's why cannot be removed by dialysis. Inactive metabolites are excreted in urine in very small concentration, like 2 to 5%. Even dose need not to be adjusted in the renal patient, because inactive metabolites present in the urine is in very small concentration, like 2 to 5. So no need of dose adjustment in the renal patients, cannot be removed from by the dialysis. Therapeutic uses of erythromycin. It is a drug of choice specifically against the gram-positive, aerobic gram-positive bacilli and cocci, like for example, diphtheria and sepsis caused by the coronabacterial infection, pneumonia caused by the mycoplasma infection, legionella infection, chlamydial infection, like for example, chlamydial infection in respiratory tract, in eye, genital, and newborn. So erythromycin will be the first drug of choice for the chlamydial infection. Pertussis, specifically in the whooping cough, community-acquired pneumonia, as a penicillin substitute in the penicillin-sensitive patient. For example, in the tetanus, syphilis, staphylococcal infection, and streptococcal infection. It is also used as a prophylactically, specifically in endocarditis prior to the dental procedure. Prophylaxis of the rheumatic fever in penicillin allergic patients. In Helicobacter pylori, erythromycin is used. Erythromycin is specifically used in the patient having a peptic ulcer for the eradication of H. pylori infection. It both used in the triple and quadrant regime. Dosage of erythromycin. The oral dose of the erythromycin is 250 to 500 mg QID, and for children 40 milligram per kg per day. An IV dose of the erythromycin is 0.5 gram 8 to 12 hour hourly. Adverse effect of erythromycin. Erythromycin causes GIT upset, nausea, anorexia, vomiting, diarrhea after oral administration. Most common adverse effect is diarrhea, because erythromycin is a gastroparesis agent. It is a prokinetic agent. The erythromycin have a specific receptor in the GIT smooth muscles, which is motilin receptor. When we give the erythromycin through oral administration, it directly bind with the motilin receptor present in the GIT, which stimulate the GIT motility, increase the GIT motility, resulting in the smooth muscle contraction and ultimately diarrhea. Liver toxicity. Specific salt of the erythromycin, like estolate salt. If a patient use more than in more than 14 days the estolate salt, acute cholestatic hepatitis like fever, jaundice, impaired liver function test, probably as a hypersensitivity reaction. Probably it is a hypersensitivity reaction, but it causes the abnormal liver function tests like ALTs, SGPTs, etc. Other hepatic hypersensitivity reactions include fever, eosinophilia, and skin eruptions. So, cardiac toxicity. Erythromycin can cause cardiac arrhythmias with the QT prolongation, especially in the patient with underlying cardiac diseases. Some studies reported confirmed a link between the erythromycin and ventricular arrhythmias, ventricular tachyarrhythmias, and a sudden death in patients that prolong the metabolism of the erythromycin, specifically Drugs like the Venampamil and diltiazem, both are the calcium channel blocker. Both are the L-type voltage-gated calcium channel blocker, specifically used in cardiovascular abnormalities like in the in angina, in hypertension. Most commonly, these drugs are used specifically for example, in arrhythmias by interfering with a specific enzyme like CYP3A4 enzyme, microsomal enzyme, resulting in the prolonged metabolism of erythromycin. Drug interactions. Erythromycin have microsomal enzyme inhibition, for example, like it increases the concentration of anticoagulant like warfarin, oral anticoagulant like warfarin, and theophylline, which are metabolized by CYP1A2 microsomal enzyme. Erythromycin inhibit this, resulting in the increase in the amount of warfarin and theophylline in the plasma. Both are the lower therapeutic index drugs. Both have lower margin of safety, low margin of safety. Methylprednisolone and cyclosporine are metabolized by CYP3A4 enzyme, and erythromycin itself are metabolized by the CYP3A4 enzyme. So they utilize the CYP3A4 enzyme, resulting in the increased concentration of methylprednisolone and cyclosporine in the plasma. It also increases the serum level of the oral digoxin due to increased bioavailability, increase the concentration of antihistamines with the increased risk of arrhythmias, terfenadine and estimazole. References from like, the basic and clinical pharmacology by the Katzung, the pharmacological basis of therapeutic protein synthesis by Goldman Gilman and Tara Pharmacology. Thank you so much.